Welcome to the latest podcast from the Plastic Surgery Journal Club. Each month we review and appraise a journal article from PRS and summarise it for you in this short podcast. The full paper can be obtained from the PRS Journal website.
This is Dr. Damien Marici and Dr. Jen Law talking to you following the June 2016 Plastic and Reconstructive Surgery Journal Club at St Vincent's Hospital in Sydney. The next paper we looked at was from July 2015. This was a retrospective review of patients undergoing lateral canthoplasty techniques to manage existing or potential lower eyelid malposition, identification of 7 key preoperative findings. This was by Tepper et al. From New York. And Jen, what was this paper about in a nutshell?
This paper was a retrospective chart review of all the lateral canthal procedures performed by the Jelks over a 12-month period. The specific details of the operations and procedures were discussed in another paper, but this paper really looked at the preoperative assessments and the key anatomical findings that the authors evaluated.
So, in the discussion, the author came up with a very nice figure looking at what are the key points of the physical examination that they evaluate when looking at a lower eyelid prior to surgery. What were those points?
The 7 key physical anatomical findings were vector analysis, either positive, neutral or negative, snap destruction, brisk or delayed, scleral show, the degree of that, canthal tilt, positive, neutral or negative, lateral canthal orbital rim, less than 1 centimetre, greater or equal to 1 centimetre, mid-face position, normal or descended, and lastly, vertical restriction, absent or present.
So what were the different surgical procedures which the authors evaluated?
There were 4 types. These included the inferior retinacular lateral canthopexy, the inferior retinacular lateral canthoplasty, the tarsal strip lateral canthoplasty, and lastly the dermal orbicular pennant lateral canthoplasty. Surgeon satisfaction at 1 year was 88% and patient satisfaction was 91% overall. At the 5-year mark, they found that additional 10% had to undergo further surgery.
So what were the good points about this paper?
This paper contains the experience of 2 very well-regarded oculoplastic surgeons in New York City. However, the problems were that it's a small number, over a 1-year period only. The procedures were performed in 2005, which is over 10 years away from the present day. There was no algorithm provided for how the authors selected the different types of lateral canthal procedures based on these anatomical findings, and there was a large proportion of patients who did not meet the inclusion criteria, almost 50%. We would have liked more details on the surgical techniques that the authors performed and how as many people perform canthopexys and canthoplasties in different ways. The 7-step lower eyelid checklist was very important for everyone to know about and will be of use for young and older surgeons alike.
Thank you for listening. For more of our podcasts, head to soundcloud.com or subscribe to us on iTunes and search Plastic Surgery Journals. Remember to like us on Facebook and follow us on Twitter. Thanks also to the PRS Journal team for their ongoing support.